Welcome to TAVA Talks,
where there's real teams, real voices, and real change. And we are your hosts,
Lulu Roman
and Deanna Lynch.
My name is Caitlin Cook. I am one of the general surgery residents at the University of Rochester. Thank you guys for having me on your podcast.
Yes, thank you for being here.
Of course.
Okay, so our first question we would like to ask you is, how did you hear about TAVA, and why did you decide to join?
So Dr. Cupertino introduced me to TAVA back when it was a smaller idea before all the students had joined, and I decided to get involved because I wanted to. I'm trying to do more in the community involvement, and it was a really good idea, I think, to bring, my knowledge of the surgery field, surgery world, to some of the students in the community. And so Dr. Cupertino luckily got me involved, and I was able to start off with the interview process and then stay involved and teach some students Stop the Bleed.
That's great. Do you think people should do Stop the Bleed training?
Yeah, so I think there's been more of a push lately to include Stop the Bleed kind of in the same manner that CPR classes are being taught, so in school and in the community and to adults too. And I think it's a great skill to have because it's a really applicable skill that most people probably will never need, but if you do need it, things like how to apply a tourniquet are things that people don't necessarily know without practice, right? So you guys know it's a skill that you were able to pick up right away, but without the formal teaching on how to do it, you probably wouldn't know. And it's a truly life-saving skill. So I do think it's beneficial for everyone to learn it, and hopefully you never use it. But I think, including it in schools and in just standard curriculum is a great idea.
What age do you think should be like the youngest this should be taught, the tourniquets and the kit?
That's a good question. I think there's little risk to teaching it to young kids who may not fully grasp it, and you can always refresh them later. I would say probably not before like middle school demographic. I think kids in elementary school would probably be a little bit on the young side, but middle school, high school and up I think would be pretty appropriate.
Yeah, I agree.
Yeah, me too.
Okay, next question is, what is an important step that we can take to assist with an emergency that considers surgery or medical attention like a wound?
I think one really important role that you guys are going to be able to play if something ever happens in the community is kind of having the background and the experience to get everything organized, right? So you guys have been involved in Stop the Bleed and kind of know the steps, so that's all going to be familiar to you. I think the next step would be, activating the emergency response, right? Calling 911, designating people to maybe go get the Stop the Bleed kit, right? You're going to be like the leader in that scenario because you've had all this experience. And so I think, you guys standing up as the orchestrator, the organizer in one of those emergency scenarios would be really great, and you're going to have the skills to do that.
If you put the tourniquet on and you put it tight and they tell you to stop, what would you do?
Yeah, that's tough. That comes up in the trauma bay, a good amount where you're trying to do the right thing for somebody, but it's not always the thing that feels the best, right? And I think in that moment you just have to think about your goal, which is to help them and potentially save their life, and really just reassure them the best of your ability, try to talk them through it, explain what you're doing and why, and explain that you're, trying to stop what could be a life-threatening injury from harming them, and just keep going and keep that in mind, which it can be really hard. You don't want people to think you're, hurting them on purpose or something, so just talking through it.
Yeah. If you had $1 million, what would you do to spend it on to prevent violence?
The $1 million question.
Ooh, that's tough. That is I think I would need more to give it more thought. But I mean, I think it really, a small step that we've been trying to make, especially since we're talking about Stop the Bleed, is supplying kits, because the kits they're not free. And purchasing those to supply to every public venue is something that we've been trying to do in Rochester. So just places like libraries and supermarkets, and buying those kits and disseminating them to every public space, just like every public space has a defibrillator now, one of those AED boxes.
Yeah.
We want to put a Stop the Bleed kit in every single one of those spaces, and I think that isn't free. So having money to buy the kits and put them out there would be a good first step, and then I'm sure that we would have a little bit more money in the budget that we could figure out to do it.
They are really
It's a lot.
expensive. Like,
Yeah.
I looked one up and they were like a lot of money. I'm like,
Yeah,
They're
yeah,
expensive,
and the
obviously.
ones that you have to keep them up to date, so some of the things have to be changed out. So yeah, it's a pretty financially involved project to do that.
yeah.
Yeah. All right. We've been wanting to incorporate this in our podcast for a long time. So, did you know the average time to bleed out is 3 to 5 minutes? And also, for example, if you had a wound, you can die like instantly or in between 3 to 5 minutes.
Yeah.
And it takes 7 to 10 minutes for an ambulance or safety to come. So, how do you feel about that?
Yeah, I think that really hits home why it's so important for people to have these skills, because you are probably going to be, if you're, in the area where something is happening, you're going to be there certainly first and have the ability to help way before any ambulance gets there. And so it's a pretty shocking statistic. I mean, I think it really hits home why people need these skills in the community, because they don't have the ability to wait for an ambulance. They need to be acting in that moment themselves. That's pretty crazy.
Yeah. What inspired you to become a surgeon?
So I think a couple of things. Everybody who goes into medicine should have a desire to help people and make the world better. I think that's kind of a commonality between all specialties of medicine, but surgery specifically, I've always really liked anatomy, and I do really like the trauma part of surgery, which is part of the reason I wanted to get involved with Stop the Bleed. We see a lot of our trauma patients come into the emergency department with tourniquets on, and so I know just how life-saving they can be. But anatomy and really wanting to be able to fix problems in a hands-on way is why I became a surgeon. It's sometimes can be really satisfying when you have an instant gratification moment, right? Somebody comes in really sick and you can fix them or at least help them quickly and with a tangible fix like surgery rather than medicine, which kind of is a little bit harder to see sometimes the effects of.
Mm-hmm.
What has been one of the worst experiences?
Well, I think it's always really hard when one of our patients passes away, especially when, some of our patients come in walking and talking and then they don't make it. And that's always a really hard experience. And I think we have come a long way as a field of medicine in dealing with that and the more emotional side of things. I think in the past it used to be that we would kind of sweep our feelings under the rug and not talk about it, and now we have really good sessions after something like that tragedy happens where we debrief and we talk about it as a team and what we could do better. But that's always one of the hardest things, is losing a patient.
What do you what type of surgeries do you do?
So we do a really wide variety. Since I'm still in residency, we kind of rotate through all the different surgical specialties. So when I'm on trauma surgery, we're taking care of like the immediate acute problems, like if somebody gets stabbed or shot, that's kind of our team's job to work on that. But on other surgery services, it might be more things like taking out certain organs that have problems. So like gallbladder surgeries, where we take people's gallbladders or appendix out. We fix a lot of hernias. We do some skin surgery. If people have like skin tumors, we take those out. So we do a really wide variety.
Wow.
Yeah.
Dang.
That's a lot.
Yeah.
Yeah.
Do you ever get like overwhelmed? Like, how do you cope with that?
Yeah, it can be really overwhelming. I think, certain months or certain rotations are harder than others. And I think it's really important to have a good your friends, really, like your community. My co-residents are who I rely on most of the time, because they are the ones that understand what you're going through, just like you guys. You can talk to your parents or siblings, but if you're not going through something with somebody, they don't fully understand. And so talking about it with friends is how we all, I think, get through it. And a little bit of complaining sometimes, but we try to keep it positive for the most part.
A lot of complaining.
Yeah, tell me about it.
Yeah. So what advice would you give people out there on how to cope with life and the hardships of life?
Yeah, I think, identifying the people that are a positive support in your life that you can go and talk to about things open-mindedly, and, that can look different for different situations, right? So for if I'm going to have a work stressor that I want to talk about, I might talk about it with my co-residents and knowing who I can go to. Whereas if I have a personal life stressor, I might go to one of my college friends, right? So you can have different outlets and different people in your life that, are more suitable to help you with stressors in different areas. And I think that's been helpful for me to kind of identify people at work that I know I can go to. And then also, I'm a huge fan of therapy. Got a plug for it. These days, it's like, everyone should consider that. Everyone has mental health, right?
Yeah.
Mental health isn't a negative thing.
Yeah, especially when, unlike we don't have somebody to talk to. Therapy is really good for that.
Right. Yeah, definitely. You can't always rely, on your friends every single time maybe you have something you want to talk about. So having somebody that's going to be there to listen is super important. Highly recommend.
Yeah. Okay, so what is a good experience you have had in the trauma surgery department?
I think getting to take care of people that are extremely sick when they come in and then watch them be discharged from the hospital and see them back in clinic is even better. When you can see somebody come back a few weeks later feeling well and that you saved somebody's life, or at least were a part of that, right? As a resident, I feel like I'm always part of the team that's doing that, but I think it's really huge to see somebody a few weeks later who's really grateful for everything that the team has done for them, and like, that's why we're doing this, right? It doesn't always work out that way, and when it doesn't, it's tragic, but those moments are, like, they make it worth it.
Yeah. So, last but not least, moving forward, what do you plan on doing, and what do you recommend TAVA do?
So I'm going to keep teaching Stop the Bleed because I think it's really fun, and I love getting to know people in the community like yourselves, and so I'm definitely going to stick with that throughout my training. And then I think that, you guys spreading the word is excellent, and taking steps like this to, like, involve people that maybe are involved in different ways, interviewing people that have different experiences just so that you can disseminate that information is huge. And, getting your peers involved, which is what I know the goal is. Like, that is huge because your demographic of, like, students getting involved early with these kinds of discussions and being able to carry that out, like, through when you go to college, involving more people, like, that is a huge step, just getting people involved early on in life, right?
Which is our goal.
Yeah.
Yeah.
You guys are doing great. Yeah, passionate young people, right? Like, that's awesome.
Yeah, so we can't wait.
Yeah.
We're gonna be presenting the week after next week.
Yeah.
We're gonna be presenting about the Stop the Bleed kit to high school and middle school students.
Perfect.
And Encompass.
Okay, awesome. Good for you guys. That's awesome. See, that's what I mean. I think it's like an exponential effect, right? You guys are two people, but you have the ability to talk to all of your peers and spread the word, and that's like hundreds of people, right?
Yeah.
So, good job.
And we hope that they find interest in it as well.
Yeah. And I think the message is different when it comes from somebody, that is in your circle or your peer group, right? Other than, like, some old person coming to talk to you at school, right? Like, that's not as fun. If you guys are delivering the message to your peers, I think people are going to care about it more. So, that's awesome.
Yeah. Because we understand each other.
Yeah, for sure. I think that's huge.
Yeah, sometimes we don't listen to adults.
Right. I mean, yeah, I was there. I've been there. It means more coming from somebody that you can relate to. Yeah.
It was great having you here with us today.
Yeah, thank you guys.
Thank you for joining.
Of course, I'm happy to. Keep up the good work, guys.
Thank you so much.
You're welcome.
Thank you for tuning in to TAVA Talks and being a part of our podcast journey.
And we can't wait to have you back with us on our next TAVA Talks episode.
And remember,
to always say bye to violence.